this what you are, soldier? Some useless ghoul? The local madman? No, soldier. You're gonna end up in a cell. Oh, worthless, discarded. There's no mission. And while you rock and drool, the world will burn to ashes. You are not real. You are not real. You're still talking to me, soldier. There's no mission.
Crazy, isn't it? Imagine you or someone close to you having these symptoms. These symptoms are part of a disease called schizophrenia, and chances are you will meet people in your life who suffer from this disease, as this affects 1% of the general population. We would like to help treat these patients, and therefore we need your help. In this video, we will explain what exactly is happening to this patient and what you and I can do to possibly help her. Schizophrenia is a mental disorder characterized by abnormal behavior, strange speech, and a decreased ability to understand reality. This disease consists of multiple phases associated with various symptoms. The first phase is mostly associated with social withdrawal, loss of motivation and judgment, and lack of emotion. Diagnosis in this stage of the disease is hard because presentation is very similar to the depressive disorder. The next phase of the disease is called the active phase. In this phase, the patient experiences positive symptoms, which means extra symptoms which are usually not present. Hallucinations may occur in this phase, for example, most commonly in the form of hearing voices, but visual or sensual forms may also be present. Delusions are usually present as well. Patients may feel like they are being persecuted or that their actions are being controlled by an external force or person. Furthermore, patients may develop distorted or illogical speech, which we call word salad. For example, a patient may say, "The Cat Monday train closed, hey." Patients may also experience disorganized behavior, such as rapid movements or responses, or illogical behavior, such as wearing a jacket when it's extremely hot outside. The last phase is called the residual phase. This phase mostly consists of cognitive symptoms such as memory problems and learning impairments, which are very similar to dementia. Symptoms of stages may overlap, and symptomatic presentation may vary considerably between patients. Therefore, diagnosis based on symptoms may be problematic. When in doubt of diagnosis, brain imaging techniques might aid. The cause of schizophrenia is largely unknown. Imaging of the brain, called neuroimaging, has shown abnormal brain activity in schizophrenic patients. Overactivity of dopamine, a molecule related to stress responses, focus, and alertness, is largely associated with delusions. However, this does not explain memory and mood disorders related to the disease. Recent studies have shown presence of abnormal neural integration in schizophrenic patients. Neural integration is the presence of neurons connected to each other within the brain. These connections are important for establishing certain relationships between the regions of the brain. Certain cognitive tasks require the collaboration of information of multiple areas in the brain. In schizophrenia, we see loss of these connections. When certain cognitive tasks are performed, information from multiple brain centers is not combined. For example, a visual image of a flower is not linked to a memory of a certain event and is not given any emotional value. Establishing new connections between brain areas might be beneficial in the treatment of schizophrenia. Imipramine is a drug that works by stopping the reuptake of two substances in the brain, called norepinephrine and serotonin. This means that more of these substances will be present in the brain. Imipramine is already used as an antidepressant, but there are new indications that it could also help in the treatment of schizophrenia. Brain-derived neurotrophic factor, or BDNF for short, is a molecule that has been shown important for the formation of new brain cells in a special area in the brain, called the hippocampus. Studies suggest that depressed patients have decreased levels of BDNF and have thus less new cell formation in the hippocampus. In another study, chronic imipramine administration led to increased BDNF concentrations. Therefore, imipramine is a very interesting drug to investigate because it could improve mood disorders and restore the formation and integration of new brain cells. In order to study the effects of this drug, we would like to perform a scientific study. Characteristics of people who can join our study will be an established diagnosis of schizophrenia, age between 18 and 50 years old, right-handedness, and an ability and desire to cooperate with our experimental procedures as demonstrated by giving an informed consent. Characteristics of people who cannot join our study will be previous electroconvulsive treatment, a history of neurological illness, a history of alcohol or drug dependence, or abuse within the last year. The patients will be randomly divided into 2 groups of 30. A third group of healthy individuals will also be used as an extra check whether our data is accurate or not. One schizophrenia group will be serving as a control group and the other one will take imipramine. To check whether the newly formed neurons actually integrate with the others, we can use PET scans. PET scans use radioactive substances called markers to measure the amount of a certain molecule present or active. We can use a specific PET marker to bind to a specific site on activated NMDA receptors. Receptors are molecules on brain cells that sense whether a signaling molecule is present or not, in this case glutamate. Therefore, measuring whether these receptors are active also means measuring whether the brain cells are integrated and connected to each other, because that is a prerequisite for the communication via neurotransmitters. When this marker is injected into a patient's blood, it can be best measured after 2 to 4 hours. The radioactivity washes out quickly and is therefore not harmful. Our main outcome measures will be the improvement of symptoms and quality of life, measured via a questionnaire, and the improvement in neurointegration, measured via the PET scans.
So in the end, for this trial we need funding. But why should you donate? Well, first of all, we have solid evidence that this might actually work. We have discussed neurointegration and we have discussed its role in schizophrenia. We've also discussed the BDNF molecule and its role in neurogenesis and neurointegration. By administering imipramine to schizophrenic patients, we hope to improve their depressive symptoms, but also improve neurointegration, one of the underlying causes of the disease. To monitor this, if this is actually happening, we have established a PET marker which has favorable PET marker characteristics. The drug, imipramine, that we want to use is already in widespread use as antidepressant for people who meet the criteria for depression. Possible side effects are well known. In the end, no real harm to the patients is actually done except for these side effects. So, imipramine could therefore improve outcomes for schizophrenic patients. It might improve their quality of life, and also because we're going to monitor the neurointegration, we hope to gain more knowledge about the mechanism and possible new targets for treatment. Therefore, we need funding, and therefore we need your help. So please donate and make this research come true.